Hi, good afternoon. This is our final evidence. I'm Carlos Alberto Rodriguez Santos, and my teammates are Renata Moctezuma, Kimberly Ramirez, Jose Emilio Espinosa, and Edwin Aaron. And here is our documental for COVID-19. Some emergency warning signs for COVID-19. If someone is showing any of these signs, you need to go to emergency medical care immediately. Well, the first one is trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, or bluish lips or face. For these symptoms, you need to call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID-19. The second one is avoid close contact between a sick person, even if it's inside your house. If it's possible, maintain a 6 feet distance between each other. Well, the third one is that everybody should wear a cloth face cover when they have to go to a public place, for example, the grocery store, or pick up some necessary stuff. The last but not less important is to clean frequently touch surfaces like phones, doors, table, keyboards, and stuff. Should use a household disinfectant to clean them up.
So, as we all know, we're going through this pandemic disease, the COVID-19, that has everybody wondering and everybody questioning so many things. But I think that the most important question to do right now is there a cure? I mean, if I get infected, what will happen? Like, can I get cured? You can. Like, there's people that have already been cured, but there is no like an actual treatment. They haven't found a vaccine or any drug or any treatment that could help you to cure this disease. I mean, of course, you can take like some medications to like help you with fever and symptoms like that, but there is no like an exact cure or treatment for this disease, like the general disease. Um, Scientists have been working on finding a vaccine, but at the moment there is no one yet. There is no one that can find this vaccine. So right. As we all know, this disease has been all around the world, and I think that our first mistake was taking things for granted. Like we thought, oh, it started in China. Like, why do I have to wear a face mask? Like, I live in the other side of the world. I won't get it. But now we have all seen that that's not the case. Like, this disease is very quickly to sparse, and yeah, so right now there are too many people that are dead because of this disease. We are all in risk of getting it. I mean, like, there is no like a predetermined age where you don't get it, but like if we are young, we can get more chances of being cured. Like, people from over 80 years old get have more risk of being dead because of this disease. They have 21.7% of the death rate in confirmed cases, and a person from 20 to 29 years old has like 0.2 probabilities of dying because of this disease. So I think that we have to be very careful and very thoughtful about the people that are surrounded us, because we're not just affecting us, we're affecting everybody.
So, well, for the next topic of coronavirus medical issues, I am going to talk about the fatality rate by comorbidity. What is comorbidity? Is a pre-existing medical condition. This means that something apart from coronavirus that you already had. Why is it important to talk about this? Because you need to know that the people with this comorbidity or medical issues needs to be well taken care of. I mean, everyone has to take care of themselves, but these people have a very high risk. So talking about numbers, I am going to tell you in order of less to the highest the percentage of death rate in the different medical conditions. The first one is cancer. It has a 5.6% of this medical condition. This means that it's the lowest, but still very, very risky. Why am I talking about all these diseases? Because it's important for you to know that you have to take well care of the people with these diseases. No matter if it's your familiar or people around you, are the people that really needs to be taken care of. Then hypertension with 6.0% of death rate, chronic respiratory disease with 6.3%, diabetes with 7.3%, and the highest, that is cardiovascular disease, with 10.5% of death rate all cases. This is very important to know, to take care of the people around you, your family, and anyone you can help. So now let's talk about numbers. Coronavirus pandemic, it is affecting all the world, every corner of the world. And we need to visualize the huge magnitude of this pandemic. Here we have a graphic supplied by the World Health Organization 1 month ago, during the first week of April. We can see how the disease was spreading mostly in Europe, Africa, and India, and we can see how it was just starting to begin all around America. So we have 1 month ago, we had 896,450 confirmed cases of COVID disease and a magnitude of 4,550,026 deaths all around the world. We have that the countries with most cases are United States, Italy, Spain, China, Germany, France, United Kingdom, Switzerland, etc. This is 1 month ago. Now we have today Covid-19. This is a dashboard supplied by the Johns Hopkins Hospital in the United States. We can see how just today the pandemic is huge. It is a real thing. It is a real pandemic. It is affecting all the world. We can see how in Asia it is getting down. Their numbers are being stabilized, but Europe, Africa, and of course, all America is having a dangerous situation all around America. We can see the numbers of confirmed cases all around the world in 4,137,591 cases of people with COVID-19 disease. This is for us to magnetize all the numbers are real. This is real. This is happening. This is not just in our country, just in our state, just in our nothing. It is going through all around the world. We have huge numbers still in the US with more than 1 million deaths. Spain, United Kingdom, Russia, Italy, France. This is scary. This is scary for anyone to see. The deaths are 26,000 deaths just in New York. It is incredible to see this. So now let's go to Mexico. Here we have the chart, also by the Johns Hopkins Hospital, Mexico 1 month ago. We can see that we had confirmed cases of 103,078 cases, just 37 deaths, which was good for that time, 35 people recovering, and these are the numbers for Mexico 1 month ago. The next graphic, Mexico today. It is amazing how much it is growing in our country. Confirmed cases of coronavirus disease in Mexico are 35,002 today. And the deaths, amazing how the number has grown, are 1,378 deaths today in Mexico. This is just for you to visualize the magnitude of this pandemic and why it is important to follow all the rules. Of course, our government is saying that this is the peak, the greatest month of people getting sick by coronavirus disease, but it is important for us, if we want to be according to the chart that our government is saying, that next this month it is gonna be low, not higher. But this depends to us, not our doctors. This depends to us for staying home and staying safe.
In Mexico, we have over 35,000 people infected by coronavirus or COVID. We had an increment of 1,562 people last Sunday, the May 10th. And it is seen that this number will increase in the following days. Over 1,700 people have already recovered, but it's a little bit difficult to know this exact number because as they are infected, health workers such as doctors, nurses, or paramedics are at risk by being in contact with them, the people supposedly recovered. And there are cases in which some of these people have given a false negative to COVID. What does that mean? It means that these people may look or feel like they are okay, but in fact they are still infected. This is a way in which the virus is continuously being infecting other people. However, we had an increment of 112 people recovered last Sunday, and this added to the past records. We had a total of 3,465 people recovered. There are 8 states in Mexico with more than 1,000 cases. These states are CDMX, Estado de Mexico, and Baja California with over 2,000 cases. The next one are Tabasco with 1,531, Sinaloa, Veracruz, Quintana Roo, and finally Puebla. The states with the less confirmed cases of coronavirus are Tamaulipas, Sonora, and Guanajuato with 442, 415, and 414 people respectively. As you can see from the graph, it is an obvious increase of cases in Mexico since the beginning of May. The day with less cases confirmed in May was May 5th with a total of 1,120 people. The average of confirmed people with COVID in May is around 1,579 people.
And now let's discuss about the possible cures for the coronavirus outbreak. As for the 11th of May of 2020, there is currently no FDA-approved treatments or vaccines for the coronavirus, Chinese virus, or COVID-19, and it's very possible that it will stay like this for the next few months. But there is still hope, since many researchers are already finding new ways that already existing drugs can be repurposed for the recovery of patients. There is over 150 drugs that are already being investigated around the world, and most of them are just already existing drugs that are being tried against this virus. The World Health Organization, the WHO, has launched a solidarity trial, which is aimed directly to the accessing of the most promising treatments. The UK says its recovery trial is by far one of the world's biggest, with over 5,000 patients that are already taking part of it. And various research centers are investigating how the survivor's blood can be used for a treatment. One of the biggest questions that we have asked ourselves is what types of drugs might work? And as for now, there is currently only three different approaches. The first one being the antiviral drugs, which affect directly the coronavirus ability to thrive into the body of someone. Secondly, we have the drugs that can help to calm down the immune system. When a person is very ill, there is the possibility that their immune system can overreact and make a collateral damage to their body. And lastly, we have the antibodies. Those ones can either be from survivors, blood, or from the lab, or made from labs. And those ones are used for attacking the virus. Now, from these three options, another question that we have is which is the most promising coronavirus drug? The latest clinical trials of remdesivir, which is an antiviral drug that has been originally made for the treatment of Ebola, has been more than promising. The US National Institute of Allergy and Infectious Diseases, the NIAID, found that remdesivir cut the duration of symptoms from 15 days to only 11. The trial involved over 1,000 people around hospitals, which are all over the world, and some of them were just given this drug or just placebos. When I refer to placebos, it's just a substance which doesn't have any medical purpose and is just for the effect of the mind trying to recover the body. It is possible that the remdesivir may help for the recovery of a person. And since it's very possible that people can stop having to be treated in an intensive care. But this does not mean that it's very possible that the remdesivir can prevent death. It is thought that the antiviral drugs are more effective when it's used during the first stages of this virus, and meanwhile the immune drugs are more effective for the people that are already in a very critical state. The US data of remdesivir was published at the same time as a trial of the same drug was used in China, in this case being in Wuhan, and this has been reported by the Lancet Medical Journal, which showed that it was very ineffective. But we must take into account that this trial in Wuhan was incomplete due to the success of the Wuhan place being able to success the lockdown, and that meant that the doctors ran of patients. Another one that has been tested and however has been shown that not having any positive results, that was the BCG vaccine. This vaccine is most known as the tuberculosis vaccine, and unfortunately it is talked and has been discussed with the WHO that this drug was just unreliable and that the trials have been manipulated. That's all.
Thank you for hearing all this information about COVID-19. We're very happy to share it, and we think that it's very important for everyone to know what we are dealing with, so that we can work, that we can stay safe, that we can make smart decisions for our health and for our world, because this is worldwide. So We need to all stay together and stay safe for the good of the whole world. Take care.